Humanoid painful groin lump in a 55-year-old LD. A 55-year-old woman presents with a history of noting a painful and tender groin lump for 24 hours. On examination, she has a firm, tender lump in the left groin as illustrated. No cough impulse is discernible. Vital signs are pulse 107, BP 161 ohmorg, and temperature 37.8 degree. Which one of the following is the most likely diagnosis? A. Strangulated inguinal hernia. B. Strangulated femoral hernia. C. Psoas abscess. D. Primary lymphoma. It reads metastatic neoplasm. Give time to think. Answer. Let's break down the answer to this clinical question. The correct diagnosis is B. A strangulated femoral hernia. Here's why. Option A, an inguinal hernia, is less likely. While common, this presentation below the inguinal ligament is more typical for a femoral hernia, especially in a middle-aged female. Option C, a psoas abscess, typically presents with fever, back pain, and a positive psoas sign. This patient's symptoms are more localized to the groin. Options D and E, lymphoma or metastatic neoplasm, are possibilities for a groin lump but are usually less acute and less painful at initial presentation compared to a strangulated hernia. The key points to the correct diagnosis, strangulated femoral hernia, are the patient's demographics, female 55 years old, and the location of the lump, which is firm, tender, and has no cough impulse. This clinical picture is classic for a femoral hernia where a portion of the intestine is trapped in the femoral canal, compromising its blood supply.